Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with small intestine, large intestine, liver, gallbladder, and pancreas ailments, beginning with the letter A, first part. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address the issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small, large intestines, liver, gallbladder, pancreas, kidney, bladder. Then ailments specific to women and men, then issues of the hormones and metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and then special issues of infants, diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. And they also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what's meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So let us continue with learning how homeopathic treatments can help with liver, gallbladder, large and small intestine ailments that begin with the letter A, first part. From the stomach, food enters the duodenum and small intestines. The food is then squeezed into the cecum through a small valve, then passes into the ascending, transverse, and descending parts of the colon or large intestine, and finally to the rectum and anus. The total distance between the stomach and the anus is about 26 feet. The whole journey takes 18 to 30 hours from the time the food leaves the stomach. The liver and pancreas empty their digestive secretions into the duodenum through a common duct, the bile duct. Bile produced by the liver emulsifies fats, and enzymes produced by the pancreas get to work on proteins, starch, and fats. The liver does many things besides aiding digestion. It stores glycogen, a compact form of glucose, and also vitamins A, B, D, E, and K. It removes toxins, for example, alcohol. from circulation. It manufactures blood proteins and blood clotting agents. It synthesizes cholesterol, a vital component of all cell membranes and the precursor of many hormones. It converts saturated fats to unsaturated fats when the body is obliged to use fat rather than glucose for energy. It breaks down and recycles the iron-rich oxygen-carrying pigment hemoglobin. It dismantles excessive amino acids and excretes their nitrogen-containing components into the blood as urea. Urea is one of the constituents of urine. It also produces a great amount of heat because of all the chemical reactions going on inside it. The pancreas is a gland about 6 inches long, lying beneath and behind the stomach. It produces large amounts of sodium bicarbonate, as well as digestive enzymes. Sodium bicarbonate is alkaline and therefore neutralizes the hydrochloric acid produced by the stomach. It also produces 2 important hormones, insulin and glucagon, which controls sugar uptake by every cell in the body. The gallbladder has no secretory function. It merely stores and concentrates bile sent to it by the liver and empties it into the duodenum in response to a hormone that is secreted whenever fatty food leaves the stomach. The small intestine has 2 functions: to complete the food breakdown process and to absorb nutrients into the bloodstream. Although it is only 21 feet long, it has a total absorptive area of about 200 square feet. This is because its inner walls are lined with millions of finger-like projections called villi, each containing blood capillaries and tiny tributaries of the lymphatic system called lacteals. Amino acids, glucose, small fat droplets, vitamins, and minerals pass into the capillaries and larger fat droplets into the lacteals. Whatever remains unabsorbed by the small intestines, about 5% of fats, 10% of amino acids, fiber, some vitamins, bacteria, intestinal secretions, salts, water, all pass into the colon, where it is gradually compacted into semi-solid feces. The bacterial population of the colon manufacture vitamins K, B12, B1, and B5, and certain amino acids. These are absorbed by the walls of the colon, together with salts, water, and other valuable substances. Transit time through the colon depends mainly on the amount of roughage in the diet. Too little roughage causes constipation and related ailments such as hemorrhoids and diverticulitis. Abdominal pain. Strictly speaking, the term abdominal pain covers all forms of pain, aches, cramps, colic, etc., that is felt between the diaphragm and the groin. It therefore includes stomach ache, although pain due to ailments of the upper parts of the digestive tract, stomach, duodenum, pancreas, gall bladder, and liver, is likely to be felt in the upper abdomen, behind the lower ribs, or between the ribs and the navel. Acute abdominal pain, pain so severe that the slightest movement is agony, may be due to appendicitis. If the appendix ruptures, there is severe pain in the lower right abdomen, with vomiting and fever, and obstruction of part of the intestines or bowel, and the abdomen is distended and there is vomiting, constipation or diarrhea, and an inability to pass wind. Acute pancreatitis is a severe pain in the upper abdomen, radiating to the back, with vomiting. A perforated peptic ulcer has sudden intense pain, followed by shock. Diverticulitis is pain in the lower left abdomen, fever, nausea, or internal injury, all of which can very swiftly lead to peritonitis. All are emergency situations, so-called 911. Once in the hospital, it may be necessary to open up the abdomen to find out what is wrong. Self-help. If pain is severe, do not drink or eat until you have seen your doctor, and do not take any painkillers or drink alcohol. A hot water bottle or an ice pack applied to the right side of the pain may help. Specific remedies to be taken for up to 10 doses only until medical help arrives. For a suspected burst appendix, use Lachesis 6C every 5 minutes. For a suspected obstruction, use China 6C every 5 minutes. If the person is in a state of fear and shock, use Aconite 30C every 10 minutes. If the pain follows an injury, use Arnica 30C every 10 minutes. Acute abdominal pain can also be due to gastroenteritis or food poisoning. In this case, the symptoms are diarrhea, vomiting, fever, renal colic. The pain extends from the small of the back to the groin. Another possibility is acute pyelonephritis. In this case, there is a fever as well as pain. Another possibility is gallstones. In this case, the pain is under the right ribs. With cystitis, there is pain or frequent urination. With shingles, there is burning pain localized to a strip down one side of the abdomen and tenderness. If it is indigestion, especially after alcohol or heavy meals, or diviculosis or diviculitis, there are cramps and tenderness in the lower left abdomen, constipation, disruption to blood flow, and there are bowel and intestines, possibly caused by thrombosis. A hemorrhage or an aortic aneurysm, or even a sudden change of diet, will result in constipation, lots of wind as well. In pregnancy, acute lower abdominal pain, especially if associated with vaginal bleeding, may signal an ectopic pregnancy or a miscarriage. If the pain is severe and continues unabated for more than 1 hour, or occurs during the first 3 months of pregnancy, see a doctor within 2 hours. Among the many causes of chronic or recurrent abdominal pain are pelvic infection, smelly vaginal discharge or hiatus hernia, heartburn made worse by bending or lying down, indigestion and peptic ulcer, with the pain relieved by antacids, or pancreatitis, with pain in the upper abdomen, or gallstones, with pain in the upper right abdomen, or Crohn's disease, with cramps after eating, diarrhea, hernias in the abdominal wall in the area of the navel or groin, or irritable bowel syndrome, often with one-sided abdominal cramps, and ulcerated colitis, with the left side abdominal pain relieved by passing stools. If the pain is located between the navel and the breastbone, and the person is losing weight at the rate of 1 pound or more per week, the cause may be cancer of the stomach. If there is persistent pain in the lower abdomen with fever and alternate bouts of constipation and diarrhea, the cause may be cancer of the colon. In either case, the appropriate action is to see a doctor within 48 hours. If the abdominal pain can be traced to any of the causes mentioned above, see the relevant entry for the homeopathic treatment. Where the pain is recurrent but the cause cannot be found, constitutional treatment would be the sensible course. Specific remedies to be given every half hour for up to 10 doses when the pain comes on. If the pain onsets and stops with equal suddenness, as if the abdomen has been gripped by a hand and then released, with the face red and hot, and the abdomen tender and sensitive to the slightest jarring, use Belladonna 30C. For pain like a stitch, and the abdomen feels as if it is about to burst, and pressure makes the pain worse, with pain so severe that the person cannot move, think, or talk, with breathing shallow, use Bryonia 30C. For cutting pain, which causes the person to double up and cry out, with the abdomen distended with wind, and an attack may follow an angry outburst, use Chamomilla 6C. For violent cutting, twisting pain just below the navel, that is relieved by passing wind and bending forward or pressing on the abdomen, use Colocynth, that's Colocynth, Colocynth 6C. For pain so violent that the person cries out and it is relieved by warmth, friction, and pressure on the abdomen, use Magnesia phos 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.